presentation on the coronavirus versus citicoline. Some of you have probably already seen my presentation on melatonin and the use of melatonin in the treatment for COVID-19 infection. I actually came down with the coronavirus myself, and I had been using melatonin for weeks prior to getting the infection, and the symptoms were pretty mild. I had overt symptoms for about 4 days, followed by a lot of days of chronic fatigue, but not too bad. No lower respiratory tract symptoms. I can't say for sure how much the melatonin helped, but I still highly recommend it if you want to keep your symptoms as mild as possible, because it does beef up your immune system. Now, what I'm recommending today, the citicoline, for one thing, I have to thank a friend of mine, Ted Huff, for bringing this to my attention. He sent me a link to a presentation on this subject, and without that, I wouldn't be doing this. I was very impressed with that, and so I just want to give a shout out to Ted there. Thanks. Let me jump right into this. All right, when most of us, it looks like between 40 and 80% of us are going to end up infected with this virus at some point. And when we do, we've got a war in our hands. All right, you've got your immune system versus the coronavirus, and there's going to be a battle. Now, for most of us, 85% of the time, we're going to win. We're going to win big. We're going to beat the crap out of this virus and not have any scar tissue, and we're not going to die. All right, we're going to win. Unfortunately, there are a number of people who are not going to do as well. They are going to win, but they're going to get beat up really bad, and some people are going to lose. And so, yeah, what we want to do is shift things in the favor of winning. Now, one of the weapons that the coronavirus has that helps it a great deal is an enzyme, phospholipase A2. That's what today's program is about. This weapon, it turns your lung cells into super soap, and it allows the virus to make babies really fast and to make us sick. It's kind of like their side has a pet dragon with fire, okay? And so it just comes out and it kind of cooks your troops there and helps the virus become the victor, or at least to win some battles before our immune system catches up and can do anything about it. Now, the thing about this enzyme, it provides the virus with a tactical advantage, obviously, but because it needs this enzyme in order to make copies of itself. It can't have a lot of babies unless it utilizes a well-functioning phospholipase A2 enzyme. So that's a weakness, because there are things you can do to weaken that enzyme. All right, we're going to get into that later. As you may know, viruses are parasites, just like a tapeworm is a parasite, okay? Tapeworm, somehow you got the eggs in your body. I'm not going to go into the details on how that happens, but it gets in there and grows into a big tapeworm. And while it's there, what is it doing? It's eating your food. It's in your colon, eating your stuff. It's using your Wi-Fi. It's not paying rent. All right? That's a parasite. And if you take it out of your body and put it in a fish tank, it dies. It doesn't matter. There is nothing you can do outside of a living organism that can make that tapeworm live on its own. It's a parasite, unable to survive on its own. Is it alive? Yeah, it's kind of alive. It is alive, okay? But it can't live independently, and so it's a parasite. Now, viruses are parasites. They don't have a cell membrane. They don't have any organelles. They don't have a nucleus or a cytoskeleton, okay? They do not qualify as living organisms, not like bacteria. Bacteria are living organisms. They can do stuff. They meet the criteria for being alive. They perform metabolism, they can reproduce, respond to stimuli, and so forth. Viruses can't do any of that. They're not alive. I would refer to them as biological robots. Now, these biological robots, they can't just infect any species or any particular cell type in your body. They have specificity. So some viruses can only affect certain species, man, monkey, turtles, whatever. Some can go and affect different species, of course. And then when they do infect you, there's only certain cell types that they're allowed to enter. And that depends on the receptors that are on those particular cells. Your lung cells and the cells lining your airways, your bronchial tubes, have a receptor called ACE2. And the spike proteins on the coronavirus fit that particular protein. And when they do, it's like lock and key. You open a door and it allows the virus to enter your cells. And when they get inside, bad things happen. This illustration is simply showing the spike proteins binding with the receptor, causing a process called endocytosis, where the virus, that spiky ball, enters the cell. Once inside the cell, the virus takes over the cellular machinery to make multiple copies of its genetic material, and it forms a brand new coat for itself, complete with new spike proteins. And then, after it's made a bunch of babies of itself, it rises to the surface, and again, it just does the reverse of endocytosis. It does exocytosis, and all these babies come popping out of the cell. So, think of the inside of your cells as containing a factory, and this factory is devoted to creating all the materials that the cell needs to stay alive and to do its job. Now, different cells do different things in your body. For example, if you're talking about a cell in your stomach, well, some of those cells are there to make acid. That's their job. So in addition to staying alive, they have to secrete acid. Some of those cells are there to make stomach enzymes. So in addition to making stuff to stay alive, it makes stomach enzymes. That's how the cells of the body are. There are literally biological factories inside of each cell that is designed to create stuff that allows the cell to remain alive and to do its job. When a virus injects itself into the cell, it takes over that factory and says, everybody stop working from now on. Instead of building stuff to stay alive and to do your job, that ends now. Now, what we're going to do is make little copies of baby me. And so it's a baby factory. And what kind of babies is it making? Baby viruses. That's what a virus does when it takes over.
We are COVID. Lower your defenses and surrender your cells. We will add more biological and biochemical assets to our own. Your former purpose will be erased, and your only goal will be to adapt and service us. Resistance is futile.
And that is not an exaggeration. That is exactly what the virus is doing. Now, one of the things that I'm going to be presenting here is information that I gleaned from Dr. Robert Shaw, who works at the Great Plains Laboratory, and he put this together, and he posted it just within a week. He put this out, and I thought it was really, really good, and so I'm going to briefly go over some of the stuff that he talked about. It is available online, by the way, if you want to see his presentation. I think he did a very good job. All right, this is a picture of the coronavirus. The reason it has that descriptor, coronavirus, is it looks like the sun. If you were to look at the sun, of course not directly because that wouldn't be good for your eyes, but if you were to block out how bright it is in the middle, you'd see all those solar flares going off around it, and so that is how the sun looks, and so hence viruses that look like that are called coronavirus. Phospholipase A2 plays a role in pain, in disease, in debilitation, in death. It's produced by multiple microorganisms. It's one of the major factors that mediates the toxicity of venom and toxins produced by animals such as rattlesnakes, spiders, and wasps. We also know that in certain human conditions, phospholipase A2 is elevated. It's elevated in autism and Alzheimer's disease, significantly elevated in multiple sclerosis, atherosclerosis, pancreatitis. If you have a stroke, it's elevated. I mean, there are a lot of situations where this particular enzyme is increased in activity. And that's not a pleasant experience. It is rather painful and somewhat debilitating. What does it do? Well, here we have a picture of one of the fatty acids that are present in the cells of every cell in your body. It's called phosphatidylcholine, also called lecithin. Now, Oftentimes, lecithin is, for the most part, that's a good thing. Your body is made up of a lot of lecithin, okay? But what happens when phospholipase A2 gets a hold of it is that it cleaves off one of those fatty acids. So you know how the molecule, phosphatidylcholine, sort of looks like one of those old-time clothespins. You have a top, where it says choline and phosphate. That's the part that likes water. It has a charge on it, and so it goes with water very well. That bottom part doesn't have a charge. Those are two fatty acids, usually a saturated fatty acid and a non-saturated fatty acid. What does phospholipase A2? It cleaves off the non-saturated fatty acid. And when it does that, it turns what remains, the two pieces, into powerful detergents. So you start with a fatty acid, which has very weak detergent properties, and it turns it into a markedly potent super detergent. In this particular slide, at the bottom of the slide, what you see is the lipid bilayer. Those are the fats that make up the cell walls of all the cells in your body. At the top, you see a coronavirus there, or the bottom half of a coronavirus, locking itself into the receptor on the surface of the cell. Now, these fats that make up the cell, those ultimately are the same type of fats that make up the circle of your virus. So your virus walks around in this sphere of fat. Where does it get that fat? From the last cell that it infected. How did it get the fat? Well, one of the ways that it got the fat was it used phospholipase A2 as a detergent to disrupt the plasma membrane of the last victim. And that's how it stole their fats. Okay, I'm going to come back to that and say that many times, so hopefully you'll understand what I'm talking about if you didn't get it from what I just said. So take a look at what I just added here just so you can orient yourself, see how that structure of lecithin, the phosphatidylcholine, is exactly the same structure that you see in the lipids of our lipid bilayer here. So imagine coming through and cleaving off one of those pant legs, because it does look like a person with pants coming out of his head, okay? But one of those pant legs get cleaved off, and when that happens, now you have super detergent. It's like one guy turns into a zombie and then starts chomping on his friends, and they turn into zombies, and so forth and so on. Okay, that's kind of the detergent effect of phospholipase A2. So regular lecithin, a very weak detergent. It's not even, nobody would even buy it. If that was a detergent on the shelf, nobody would buy it because it's just too weak. It's not that strong. But you cleave off one of those fatty acids, and that arm or that leg that got cleaved off, that is arachidonic acid, and that's a big deal because arachidonic acid is used to make a lot of inflammatory molecules. So that starts an inflammatory cascade, and inflammation is not something that you're necessarily going to want, okay? So yeah, keep that in mind. Arachidonic acid, now that you've freed it, is free to go on and become inflammation. And we now have lysolecithin, which is the lecithin with one leg. Okay, it's called lysolecithin, and it is a powerful detergent. So let's discuss the anatomy of the virus before we go on. Okay, it's very simple compared to large organisms like us. It's very simple, okay? So what you have, first of all, let's start from the middle and go out. Okay, you notice in the center here, you see all those squiggly, stringy things? That's the brain, if you will, of the virus. That's your ribonucleic acid. Those are the digital instructions on how to make more viruses, all right? It also governs the behavior of the virus. Those red plungers on the outside, those are your spike proteins. Those are the babies that are going to interact with the receptor on the cells that it infects. And then that grayish ball structure, that's your lipid membrane. That's your lipid membrane. So that's what houses the genetic material and serves as your vehicle. That's your house. That's the majority of the body of our virus. So imagine you're a virus floating around and you come to a cell. Now you know that you don't have anything because the virus doesn't have all that it takes to live on its own. It doesn't have an internal factory that is able to make stuff so that it can stay alive. How does it get stuff to create to reproduce itself? It steals it. It steals it. It's a thief, right? So it comes to your cells and it has to get inside it so that it can steal your stuff and make babies. So imagine you're the virus and you come across this wall, a big protective wall with no ports of entry, all right? And you're thinking, okay, I need to use these bricks because I don't have my own bricks. I need to steal these bricks so that I can use them for my lipid membrane. Well, how do I steal them? It's a wall. Wouldn't it be nice if you had some 409 molecular acid that you could just squirt on the wall and it would cause the cement to dissolve? If that happened, you could just go right in there and take those bricks out and use them for your own purposes. And that is basically what the phospholipase A2 is for the virus. It's molecular acid to be used to dissolve the cement of the lipid membrane so that it can take those lipids, it can take those fats and incorporate it into its baby viruses. So now each baby virus will have its own little lipid membrane so that it can go off and infect other cells. So phospholipase A2 is very important for doing that. It does other things as well, but I want to make this simple so everyone can understand it. So the primary function is so that it can make baby viruses. It needs it for baby virus manufacture. So here we see the COVID-19 virus life cycle. Comes into the cell, binds to its receptor, does endocytosis, we have the uncoding process, and then it runs its nucleic acid through a duplicating machine, okay, transcription, translation, and then it takes over your cellular factory. The nucleus, the Golgi apparatus, the endoplasmic reticulum, these are organelles inside your cell that make stuff. And so it takes over those guys and just makes baby viruses. And ultimately, through exocytosis, it leaves the cell brand new baby viruses and float off to infect more of your other cells. Brought to you by phospholipase A2, molecular acid for the virus. So without that biological detergent, it would be very difficult for the virus to make babies, okay? So this is a powerful weapon for the virus. Now, it's not that it comes with the gene to do that itself. It doesn't come with its own phospholipase A2 gene. No, it takes over your copy of phospholipase A2 and makes it overexpress itself. So phospholipase A2 concentrations go up all over the place. And this is extremely destructive. Everybody, that's one of the reasons why when people have COVID-19 pneumonia, they say their chest hurts. Phospholipase A2 hurts. It incites a pain response as it's dissolving you with all this detergent that's being released. In the meantime, in the face of this onslaught of destruction, your immune cells are trying to get in there and kill this virus. Now, as I mentioned in my melatonin presentation, because this virus incites a predominantly neutrophilic response, your white blood cells are going crazy. If your white blood cells don't have any brakes, that's one of the reasons why I like melatonin. It kind of helps put the brakes on so that they don't go too far and do more damage than good. But they tend to do a lot of damage. And people that end up with really bad COVID-19 pneumonia, your immune system goes overboard and you end up dissolving parts of your lung because you just liquefy everything trying to get at this stupid virus. And the overkill does more damage than the virus itself sometimes. So we want to stop this, and so we got a big battle going on. Our battlefield is very messy. We got our white blood cells going at it, and we have our COVID-19 increasing expression of phospholipase A2 acting as a detergent, so everybody's got their eyes burning and everything, and their skin is all weird because of detergent and everything. So it's a really nasty battleground. There are other viruses that use phospholipase A2 offensively, and they too need it. Without it, they can't do very much damage. Take, for example, hepatitis C. Hepatitis C also uses phospholipase A2 in order to replicate and spread. And if you take this particular virus in a liver cell that doesn't have the gene for phospholipase A2, guess what? The virus is totally inhibited. It can't go anywhere because it needs phospholipase A2. That just stresses how important, it's not just, it is not a minor player. It is a major player in the spread of the virus. It's the same thing with influenza virus. It needs phospholipase A2 in order for budding to occur. Budding is when when you make a bunch of baby viruses and you need to leave the cell. Budding is that process of exocytosis where the new viruses leave. And there's two ways they can get out. I mean, there's two ways where when a cell is taken over by a virus, and the machinery of the cell is now being used to make baby viruses, there are two exits. One is by budding, where you can just make new babies and go excitosis, where it go up and it blends with the plasma membrane, and then they come out one at a time, like that, okay? The other way is boom! The cell fills up with viruses, a kill switch is hit, and boom, the cell dies and all these babies come out. Kind of like Alien, it just out it goes, and the babies are released, and the host cell is like dead. Okay, that's the other way it can happen. With coronavirus, it's the first one. Now, as I mentioned earlier, phospholipase A2 is not just a toxic substance. It's produced by microorganisms. The poison of many poisonous snakes is painful because of the phospholipase A2. Bee stings, black widow, spider venom, all of these cause really horrific pain because of this nasty detergent effect of phospholipase A2. Other microorganisms that need phospholipase A2 in order to do their thing are human cytomegalovirus, Toxoplasma gondii, and E. coli. Mueller and co-workers discovered that if you use coronavirus, and they use the Middle Eastern respiratory virus, which is another coronavirus that's actually worse than the one we're dealing with. It's not as infective. It's not as easy to catch, but it's much more lethal. It's about 30% mortality rate. So the Middle Eastern respiratory virus was a bad dude. If you caught it, your chances weren't that good. Now, the thing about this particular one is that when they use pyrrolidine, which is a known phospholipase A2 inhibitor, when you treated the cell cultures with pyrrolidine, it stopped the virus. It prevented the virus from replicating. What this demonstrates was that in order for the coronavirus to replicate, to make copies of itself, it needs a well-functioning phospholipase A2 enzyme. If you inhibit that enzyme with an inhibitor, then the virus is stopped. Now, in this particular slide, I don't know why they reported it this way. In every other study that you look at, you start out with 0 on the left-hand side and then the higher doses on the right-hand side. In this study, it's at the top, it says, 7. Those are the type of cells that the virus is infecting. Okay, so that's just the name of it. Okay, now, what you notice, start with the 0. At 0, those are cells that have no inhibitor. So the pyrrolidine is at 0, so no inhibitor, and you see 10 to the 5th viruses. So that's like 100,000 colony units of the virus. Now you look at 5 and 10, those are micromoles of the inhibitor. So at 5 micromoles, a little bit of effect, 10 micromoles, no different than the 5. However, when you get to 20 micromoles of the pyrrolidine, boom, the virus is dropped down substantially. Instead of 100,000 colony units, you've only got about 1,000. So your virus load has been dropped to 1% of what it was previously without the inhibitor. So we're following 3 samples. You've got your untreated sample, you've got your pyrrolidine at 10 micromoles and pyrrolidine at 20 micromoles. And what you notice here is that at the 24-hour mark, for the untreated, you've got 10 to the 7th. Now compare that with the higher dose of the pyrrolidine, and you've only got about 10 to the 4th colony forming units, or about 10,000. It reduced the population of coronavirus to about 1% of what it would have been without the phospholipase 2 inhibitor. Okay, so inhibiting that enzyme made a big difference in how many babies the virus was able to produce. Now let's go back to that battle illustration. about maybe up to 80% of us are going to be infected with this virus, and then a war will start. Your immune system versus the virus. The virus has a dragon. It has a minigun called phospholipase A2 that is used for mayhem and destruction. It allows these viruses, to make baby viruses very efficiently. Now think, if only you had some kind of inhibitor of phospholipase A2, and you could reduce that weapon to 1% of its potential, do you think your army would have an advantage with such a weapon? Why don't we do this for all viruses? Because all viruses don't utilize phospholipase A2 as a method of spread. Okay? You don't see that with poliovirus, with vaccinia or influenza. Rhinovirus, not so much. Coronaviruses and certain other viruses, they depend on phospholipase A2 in order to spread. So then, do we all want to run out and start drinking pyrrolidine? Not recommended, and I think you're going to have a hard time finding it. So what we need to know is, are there natural agents that are inhibitors of phospholipase A2? And the answer is yes. Now, as I look through the literature, there are 3 that come up. There may be others, but I came across 3. One is ginkgo, another is turmeric curcumin, and another is citicoline, which obviously I'm going to be discussing citicoline, but we'll get to that. First, let's talk about those first 2. Number 1, I don't know, in terms of, there have not been studies head-to-head comparing ginkgo, turmeric, and citicoline. So I really can't say that I have the answer to which one is stronger, which dose is equal, what are the equivalent doses. Don't have that information. As far as I know, I don't know if anybody's even done that work. So let's start with ginkgo. All right, the problem with choosing ginkgo as my recommended agents is that, I've recommended ginkgo for cognitive enhancement, people with memory disturbance or Alzheimer's. Yeah. Okay, and, there might be some benefit there. It does increase cerebral blood flow. The problem is that it does so by causing dilation of the vessels that in the covering of your brain, in the meninges. That hurts. It causes a headache. So if you take too much ginkgo, you're going to have a whopping headache. And I think that, and I don't know what the dose is to get suppression of phospholipase A2, but if it's on the high side, then ginkgo is probably not the way you want to go. Okay? Just saying. Next one. Turmeric curcumin. That's a good choice. I think that of the 3, I'm pretty sure it's the cheapest, okay? So if you want to save money, that's the way to do it. Now, if you're going to buy turmeric curcumin, make sure that it says with bioperine or with some agent that would allow it to be absorbed. All right, now bioperine is nothing fancy. That's simply the active ingredient in black pepper. So if you do get turmeric curcumin and it doesn't have any bioperine in it, all you got to do is take your capsules, but with maybe a 1/4 teaspoon of black pepper, and then it will be able to be absorbed. Without that, you'll take it in your mouth and it'll go right out your backside. Okay, it won't be absorbed into the blood. You need that bioperine in order to be absorbed into the bloodstream. Okay, so not a bad choice. Again, I don't know the best doses though, but it does have inhibitory effects on phospholipase A2 and may explain many of the anti-inflammatory properties of turmeric curcumin. So a very good choice. All right. Okay, next, citicoline. Now, citicoline is my preferred recommendation for reasons that I'm about to get into, but it's going to cost more than turmeric curcumin. There are many different brands. I'm not promoting any one particular brand, and we'll get to the dose as we move on here. Now, citicoline has been used clinically for this particular property for some time now, and that's one of the reasons why I'm leaning toward it, because not only does it block phospholipase A2, but it has a reputation for doing it so well even when taken by mouth. All right, let me just set this up for you. It's known that when you have a stroke, what happens is you occlude a vessel in the brain, and then that brain section that was fed by that blood vessel, it starts to starve, and when it dies because it's starved to death, then you've got dead tissue in your brain, and that causes a big time inflammatory response, and that does even more damage to your brain. If you don't reduce inflammation after a stroke right away, then not just that stroke region dies, but it will expand out and more of your brain will die from the inflammatory cascade. And so it is known, one of the things that happens after a stroke is increased phospholipase A2, big time. That's part of that inflammatory cascade. And phospholipase A2, because it generates that detergent effect and it causes the production of arachidonic acid, that causes massive amounts of inflammation, because that arachidonic acid is used to create lipooxygenases and cyclooxygenases, which are inflammatory molecules themselves. Okay, so very bad. And so what we now know is citicoline use after a stroke like this undoes that process by blocking phospholipase A2. So it has a major impact on the brain by reducing that brain inflammation. And we have studies demonstrating that. This is one. Citicoline decreases phospholipase A2 stimulation and hydroxyl radical generation in transient cerebral ischemia. What they did here was they took some poor hamsters and they gave them a stroke. And then some of them they gave citicoline to, and the other poor, they didn't get anything. And then they compared the damage, and they found that, whoa, in the group that got citicoline, there was significant suppression of phospholipase A2, and it reduced the damage of those hamster brains so that they were able to go back to school and complete their degrees and everything, okay? This is just the structure of citicoline. It's also called cdp-choline. One of the weird things about this is if you call it citicoline, you spell it different. Instead of saying choline, which is the correct spelling of choline, they just spell it citicoline, which is confusing, and I've made the mistake many times in spelling it wrong. But anyway, so it goes by two names, cdp-choline with an H, or citicoline, same thing. So we got a cytosine, diphosphate, and choline at the end here. Now, one thing that was stressed in the program was the difference between citicoline and phosphatidylcholine. Don't get those two mixed up. If you have COVID-19, it's very important that you not get them mixed up, because if you have COVID-19 and phospholipase A2 is elevated, as it most likely will be, then giving a person that is the substrate for phospholipase A2. So if you give more phosphatidylcholine, then you're going to make more detergent and cause more inflammation and damage and pain. So you don't want to do that. Make sure you get citicoline, not phosphatidylcholine. So anyway, yeah, because cdp-choline or citicoline reduces inflammation and pain. cdp-choline decreases toxic lysolecithin and arachidonic acid, and is a strong inhibitor of phospholipase A2. The opposite is true of phosphatidylcholine or lecithin. So don't take lecithin if you have coronavirus. And this is just data from that study that I talked about with the hamsters. If you gave the hamsters citicoline after their stroke, compared to not giving them citicoline, the ones that got citicoline had significant reduction in the activity of the enzyme phospholipase A2. And it wasn't just in the cell, even in the mitochondria. So, one thing about citicoline is that choline allows it to penetrate into cells that it otherwise couldn't get into. So it even gets into your brain cells. Many substances you take by mouth don't get into the brain because of the blood-brain barrier. This is something that gets into all cells of the body. So if you're comparing turmeric or cumin with citicoline, that's a plus for citicoline. You don't have that same bioavailability with turmeric that you do with citicoline. And the thing about citicoline and its effect on phospholipase A2, this isn't a new finding. It's been around long enough to where it's actually in clinical practice. So this potency of citicoline to inhibit phospholipase A2 is a known thing, and up to now it's mostly been used for reperfusion injury and post-stroke, to help people following their strokes to get better and to help reduce the damage that was done by the ischemia. Okay, but here we have a new use, because again, some of these viruses, such as coronaviruses, very much depend on increased phospholipase A2 in order to spread. And so knowing that we have an agent that is known for that and used clinically, that's why I prefer the use of citicoline over turmeric or cumin. Now, turmeric has so many benefits. I was already taking that, okay? I mean, I've been doing that. all along. So I didn't stop. So I didn't have to start something new when it comes to that. So again, I support the use of turmeric curcumin because it does so many things and is so anti-inflammatory. But citicoline is just amazing. Okay, this particular article is called "Efficacy of Neuroprotective Drugs in Acute Ischemic Stroke. Is it helpful?" This is published, I believe, in 2019. And they looked at a number of things, that both prescription medicines as well as natural agents that were purported to be neuroprotective and make a really big difference in whether stroke people got better. And here are the conclusions here. There was significant improvement in the functional outcome of patients with acute stroke involving the middle cerebral artery territory at 90 days, receiving citicoline, edaravone, and cerebrolysin. However, minocycline did not offer the same efficacy as compared with other neuroprotective agents. And I think this is impressive because edaravone and cerebrolysin, I don't think those are natural agents that you can go to the store and buy. Citicoline is. That's something that's available and pretty safe, okay? So sounds like it's more expensive than turmeric. Yes, it is, but not that much more expensive. If you do a WebMD search on citicoline, it says citicoline is taken by mouth or given as an injection to help memory loss due to aging, which is the main thing most of us prescribe it for, improve vision in people with glaucoma, and help with recovery in stroke patients. It is also used for Alzheimer's disease, Parkinson's disease, bipolar disorder, lazy eye, and other conditions of the brain. But there are no good scientific research to support these other uses. Now, I would have to disagree with that when it comes to recovery in stroke patients. I think we have some very good studies to show that it is help. There is some good research there. So I don't think WebMD is up to date with regard to that. Regarding whether or not it really attenuates the effect of phospholipase A2, the evidence is very good. We have multiple studies that show that it significantly impairs or impedes the enzyme phospholipase A2. We also have evidence that in coronaviruses, when you inhibit phospholipase A2, the virus's ability to replicate is dropped substantially. So, what would be the best dose to use for coronavirus, for its prevention or treatment? We don't know because we haven't done it for that yet. We have no experience for that. It is, when you look at the published studies for stroke and brain injury and Alzheimer's disease, people use about 2,000 milligrams a day. So we know that that is a dose that really affects the inflammatory cascade. I suspect that's probably the dose we're going to need to use for the coronavirus, but I don't know for sure. I mean, my gut feeling is that for those that are not infected, I would, as prophylaxis, you might want to take 250 milligrams twice a day. Okay, just so that what you're doing is you want to slow the virus down. For most of you, when you get it, your immune system is going to serve you well, and you're going to win. Some of you will have no symptoms. Some of you will have mild symptoms. Okay, but if you can, the more you can slow it down. See, ultimately, your immune system is going to catch up with this thing and beat it. What you want to do by slowing down is allow your immune system to catch up sooner so that you get over it quicker, so that it doesn't slop down into your lungs. If you can kill it early before it progresses to those lower regions, then you're going to help yourself quite a bit. So yeah, let's slow this baby down. If you don't slow it all the way down to 1%, maybe we can slow it down to only 10% or something like that. But any advantage, anytime we can do something to slow the progression of the virus down, that gives your immune system time to catch up. So for at-risk populations, I recommend not only melatonin every day, 1 to 3 milligrams at night. You might want to think about adding some citicoline. If you're an at-risk population, you might want to do 250 twice a day, 600 twice a day. I would say, however, that if you are infected and you have coronavirus, I would definitely opt for closer to the 2,000 mark. Okay. So I hope this has been beneficial. I'm not saying this is going to stop you from getting infected. What it does, hopefully, is reduce the severity of the infection that you get, okay? It's not been tested with COVID-19, but based on what we have so far, I think it's a hopeful agent. Thank you for watching.